What do you guys think is the number one thing that people come into my office about? What would you guess?
Periods.
Periods. Okay, that's one.
Maybe I don't know.
Oh, birth control.
STDs, birth control.
You're close. The biggest thing is vaginitis. Do you guys even know what vaginitis is? She said,
We're waiting for you to tell us.
Yes. We don't have the right answer. We're teachers.
So if I said vaginitis, you wouldn't know that. But what if I said vaginal discharge?
Yeah.
Number one thing people come into, or vaginal itching,
Yeah.
or vaginal discomfort during sex. Those are like the top things that people come in for. And my frustration is that I'll tell patients to come in. They were like, can you just give me the medication over the counter? Can you just call it in? Or they'd already done the monostat for 7 days or whatever the situation is. And so that was one of the topics I wanted to discuss in my videos that I've been presenting with you all, is that vaginal health is very important. And it's okay if you have an itch or an odor or just a little bit of discharge, right? And that it's okay to kind of come to us and talk about it, right? So the whole thing with vaginal discharge is that some women don't even know that it could be normal, right?
Definitely not, because that's not old.
You're not
Good young people here.
we young people here, but you're not old.
Well, older people will tell you, oh, you have to douche. Oh,
Yeah, that's a good point.
you should put a little bit of bleach in your bathwater.
Oh,
right.
I wish I
I'm
had
sorry.
pearls.
Oh, I know exactly what you're talking about.
I wish I had pearls to clutch the pearls.
If you had pearls
Bleach?
to clutch. Yes, ma'am.
Yes.
And
I've heard of
so,
that.
fortunately,
I'm gonna
had,
take a sip to that.
You take a little sip. I've surrounded myself, with really well-educated women, and you, of course, and throughout my life, I learned that right off the bat wasn't right.
Not right.
But it is still something that you hear.
Absolutely.
Really?
That there should be, and I will blame some of the men, some of these rappers and everything. It's supposed to be, peaches and cream, pineapple, diced pineapples, all that stuff down there.
No.
So there's supposed to be nothing. And then the women also feel that pressure. I'm not supposed to have any odor, any discharge, any hair, anything. It's supposed to be
I have to say,
perfection.
the discharge is really good for people. When it's normal, healthy discharge, that means you're well lubricated. So for the rappers, we need to tell them that.
That's true.
Okay? I'm just saying.
For the Drakes out there.
Yeah.
The lubrication is good for you. Okay? But I'm glad you brought up douching.
Yeah.
Okay, so I was born in the 70s, but grew up in the 70s and 80s, and I remember my mom, and don't want to put her business out there, but she used to have that red situation, right? The red bag with a long tube, and that was considered a douche. And no, we should not be douching ever,
Right.
because it washes away the natural lubrication that our healthy vaginas make, right? So that smelling summer's eve situation, we don't need that. Okay. But I think that's funny. And the other thing is bleach. That's a no for me.
It's
It's
a no for me.
everyone.
Yeah.
It should be
It's
a
a
no
no.
for everyone.
Yeah.
But these are the things that grandmoms,
Yeah, bless their heart. But
Little apple cider in the bathtub.
I heard about that, but that's not grandmas. That's young people. I had a young person tell me about that. And my thing is, and honestly, we're joking, but no judgment.
Right.
But if you know better, you do better, right? So let's just say vaginal discharge could be normal. Now, when is it abnormal? If you have an odor, if it's a funny color, yellow, whitish, clumpy, if you are having discomfort, especially discharge, itching, odor, discomfort with sex, those are reasons to see me, because it can be different things. And these people who are self-medicating, like, can you just call me in a diflucan? No, ma'am, I need you to come in. Now, mind you, if we have a relationship and it's a chronic thing and I know that this is a thing for you, then I don't have a problem. But if I'm treating you for a yeast infection, and you have a bacterial infection, you're going to get worse.
Mm.
So, a lot of times they're upset and like, oh my God, she wants me to come in, but it's for your health and not for me.
Right.
Because I have to see 11 patients anyway. So I would love to see you because I want you to be better.
Right.
The other thing about vaginitis, so that means like itis is like infection in the vaginal area, inflammation, that kind of thing. But the other thing that I have to rule out when you have these situations is it a sexually transmitted disease? Because sometimes they can mimic things that we deal with. Discharge, odor, discomfort with sex, pain, all of those things could mimic sexually transmitted diseases. So I have to rule that out